Hello, everybody, and welcome to another session of the 2021 Affordable Care Act training. My name is Al Castellanos, and I welcome you all. Thank you very much for being here. We want to make sure that you learn as much as possible and that you enroll as many people as possible and make a lot of money in doing so. We have a lot of material. This is the continuation of a series of trainings that we have been putting in place. And so let's get started right away because, again, we're going to go for an hour and we have a lot of material to share with you. Now, remember that you can always go back and look at the previous sessions. So we have recordings on everything, so you can go back and look at everything that we have done. And also you have access to all of the different materials that we present to you during the training. So let's get started right away. Let's first cover the agenda. We had session number 1 where we did the introduction, and we started with the actual tools that we have available for you. We have a lot of tools available for you in many different platforms and in many different places. We wanted to make sure you cover that. And then we started a presentation that we're going to continue today. And remember that one of the elements, one of the characteristics of that presentation is that you can take the whole presentation or parts of the presentation and use it for you to market. So as you are looking at all the slides and everything, make sure that you digest the concepts and then you use them to market. Next week, we're going to be doing digital marketing. So we're going to be talking a little bit about digital marketing. And there are certain things that we have mixed into today's presentation. For example, we're going to be talking about help on demand today because I want you to start moving in that direction. I'm going to show you today how you get started into that so that you are ready to go when the annual enrollment starts on November the 1st. And then on the last session, we're going to be doing some product comparison, and we're going to look at quote engines. Today, we're going to touch a little bit on quote engines, but on our last training session, we will actually compare quote engines. So let's, I'm gonna glance through the first part that we covered. First, we talked about all the resources available to you at the Prinsuco website. And then we talked about how the concept of health insurance and the Affordable Care Act is part of this overall situation of an individual. And we call that the concept of total financial governance, where an individual is full of financial needs. And you need to make sure that you satisfy as many of those needs as possible. So here you are talking about one element of their needs, which is in this case the need for them to have a healthcare management and to protect themselves against illness and sickness and accidents and all that. But the idea is that you understand the fact that you want to use this as a startup of a relationship that should last for many years and should allow you to sell multiple products as you progress in the relationship with this individual. Remember, you need to be licensed, you need to be certified, and if you have earned any type of credentials, you need to show people that. You need to show people your license and your certification and your credentials, because that builds up credibility. And remember that with everything that is happening now, and when you introduce digital marketing into this process, you can sell in many places. So all these credentials are very important for you to consolidate that process. Then we talked about the world of subsidies and the world of no subsidies. So we went in detail about how the ACA law, the Affordable Care Act, created this world of subsidies and world of no subsidies. And then we talked about all the different products that now exist in each one of those sub-worlds, and how you have a lot of opportunities to sell different types of products to different types of individuals under different circumstances, based on you making the right assessment of those individuals and making sure you solve their problem with the right product. So we went through that in a previous session. Then we talked about the characteristics of essential health benefits and how this makes products very expensive, but at the same time, it makes them very comprehensive. So you need to make sure that you cover all these essential health benefits when you're doing your presentation, because what you're doing is you are telling them about all these powerful set of benefits that they have when they enroll into one of these plans with you. Then we talked about the metallic products and how they came about and how they work. And we also talked about the networks and the importance of the networks and the importance of the primary care physician and the relationship between the primary care physician and the enrollee and the network, and the consequences of you not properly explaining to somebody how this works. Okay, remember in the Affordable Care Act and anything that has to do with the marketplace, anything that has to do with a plan where you're giving people a subsidy, you are going to have some type of HMO, you're going to have some type of network involved, and people need to understand this very well, because if not, they're going to have problems and you are also going to have problems. So we went in depth into the concept of networks previously. Then we talked about the cost structure of a health insurance plan, and we covered the 5 cost elements of a health insurance plan: the premium, the deductible, the coinsurance, the copayments, and the maximum out of pocket, and the relationship between all of them, and how you need to go about this reality, and how you need to go about how to present in terms of this cost structure of a health insurance plans. Then we covered the cash flow structure in an ACA plan, which is based on the cost structure, but then this talks about how the money flows out of an individual's pocket, and what we needed to see and what we needed to understand about the different structures to see what is more convenient for an individual. So we went in depth about that, and we're going to come back to this concept when we do the product comparison in the last session. Then we talked about how we can help people, and we mentioned the fact that we can help people in 2 different ways. The first manner in which we can help people is by helping them with the advanced premium tax credit, okay? And this has to do with us helping them pay for the monthly premium. And then we can help them with cost sharing reductions, okay? And that has to do with all those elements where there is some type of copayment or coinsurance between the individual and the insurance company. So we can also help people on cost sharing reductions. And one fundamental element to understand cost sharing reductions is this annual cost sharing limits. And for 2021, the annual cost sharing limit for a single individual is $8,550, and the annual cost sharing limit for a family is $17,100. And that's where we ended last time. So we're going to take it from here, and now we're going to go to what is probably the most important element in everything that has to do with the Affordable Care Act. And it's directly related to the federal poverty level chart and everything that has to do with the federal poverty level chart and cost sharing reductions. So you have this chart here. By the way, we strongly recommend you that you print this chart. We show you previously where you can download the chart from our website. We recommend that you put, we're going to have brochures by the end of the course that you can get. And we also recommend you that you take this chart and you print it, make it really large and put it in a wall. If you have a walking place where customers come in, and this is going to be a conversation starter. And this is you going about all the characteristics of the chart is going to really help you sell, and it's going to really help individuals understand about the different types of subsidies that they can get. So let's get into the chart right away. So you see here on the left-hand side that we have a column that has the household size. And the household size, this column here, is directly related to the number of people in the income tax form. Okay, so this is the number of people in the income tax form. No one less, no one more than that. So it's directly related to the number of people in the household tax form. So you have a family of 1 or a family of 2 or a family of 4 or 6 or 8 or whatever, okay? But that's the most important thing. So what you need to do is you take that household, okay, and every member in the household, and what you do is you start adding up everything that everybody in the household, based on the definition that we just gave, all the money that they all make. So if it's just one individual, whatever he or she makes, and if it's more than one individual, anybody that makes money, okay, you're going to add them up. Anybody that is part of this number here and that they make money, no matter how much money they make, you're going to add that up. And you're going to come up with a number, okay, with a number. Okay, and that number is the one that we're going to use to apply this table here. Now, you have a on the upper horizontal line here, these percentages that go from 100% to 400%. So this is 100% of what they call the federal poverty level chart to 400% of the federal poverty chart. Okay, so from 100% to 400%. Now, you do have people that make less than 100% of this number here, and you have obviously many households and many people that make more than 400% of this number here. Okay, so you have people on this side here and you have people on that side there. Well, let me tell you something. In terms of the Affordable Care Act and in terms of cost sharing reductions, and this is very important to clarify because we still have a lot of agents that do not understand the difference between these two concepts that we're going to explain here. This is to evaluate the possibility of an individual getting help, getting a subsidy to pay for the health care policy. Okay, this has nothing to do with them being able to buy it or not buy it. They can get it. Now, this table is all about, can we help you pay for it? So this is all about, can we help you pay for it with some type of subsidy that the federal government will provide. So some people say, no, he cannot buy health insurance because he didn't get a subsidy. No, that is not correct. The individual can buy health insurance, but he won't get any help in paying for it. So this table is about paying for health insurance. And you have all these lines and all these colors, and we're going to explain all of that. So first you have this group here that goes from 100% to 150%. So anybody or any household that makes between 100 and 150% of the federal poverty level chart, okay, they are in this category here, okay? Then you have up to 200%, so anybody from 150 to 200% is this category here. And then you have from 200 to 250% is this category here. And then you have from 300 to 400% is this category here. So you have these 4 sections to it. Now, any household that falls anywhere between 100 and 400% of the table, so anybody that falls within the table, any individual or household that falls within the table, they can get help to pay for their monthly premium. So no matter where you fall, you will get help. If you fall within the table, within 100 and 400%, you will get help to pay for your monthly premiums, okay? Now, in order for you to get help with cost sharing reductions, then you need to fall between 100 and 250 of the federal poverty level chart. So you need to be in one of these green colors here, okay? So if you fall, again, if you fall anywhere in the table from 100 to 400, from 100 to 400, you get help with the monthly premium. And if you fall anywhere between 100 and 250% of the federal poverty level chart, then you will get help with cost sharing reductions. Now, something that is absolutely important is the fact that the only way that you're going to get help to pay for anything is if you purchase a silver plan. Remember when we covered the metallics and we talked about the bronze and the silver and the gold and the platinum? Well, in order for this table to apply, you need to make sure that you give an individual, or the individual enrolls into, or the individual purchases a silver plan. Okay, if you want to help them with a subsidy, they have to enroll into a silver plan. So remember, we were talking about before about the fact that we have this annual cost sharing limit. For an individual is 8,550, and for a family is 17,100. Okay, so again, what you're gonna do if they fall somewhere within the table in any one of the green colors is that this amount here, you're gonna see how it starts going down. So the exposure, the maximum exposure that they're gonna get It's not going to be $8,550, but it starts going down for an individual. And the maximum exposure for a family, which tops, okay, at $17,100, starts going down as they move around the table. So the whole thing is about moving down from these upper limits that you see in this graph here. So everything you're going to do is to lower the exposure, the amount of money that is going to be coming out of their pocket during during the year, during the annual, the 2021, let's put it that way. The maximum is for an individual is 8,550. We want for that maximum to be lower. And then for a family during 2021, the maximum is going to be 17,100. You want for it to be lower. Now, why do you have 138% here? Why do you have this 138%? And this is something that is very important because according to the federal law, any individuals that makes up to 138% of the federal poverty level chart does not have to present an income tax declaration by law. Somebody makes up to 138% of FPL, they don't have to present an income tax declaration, so they don't do taxes. So you run into a lot of people say, no, I don't do any taxes. I'm not obligated to do taxes. Well, the reason for that is the fact that they make less or up to 138% of FPL. But if anybody wants a subsidy, if anybody receives a subsidy from the federal government, they do have to present their taxes. So even though they make less than 138%, and even though according to the law, they don't have to present taxes, if they want subsidies, if they receive subsidies, then they do have to do their taxes on a yearly basis. So that's why you have this 138% here. So again, if somebody is between 100 and 150% of FPL, so somebody's here, okay, the cost sharing reduction will be up to 94% of the actuarial value in a silver plan, up to 94% help, or up to 94% reduction of what? Of this number. Up to 94% reduction from this number, or up to 94% reduction from this number. And that's a lot of money. That means that they end up paying less than $850, less than 10%, okay? They end up paying like, what, 10% is 850, like $400 or $500 will be the maximum here. And here the maximum would be around $800 or $900. So imagine going down in terms of your exposure for your whole family from $17,000 to $800 or $900 or $1,000 of maximum exposure in the worst case scenario. So these cost sharing reductions are very important. And what is going to define how much they're going to be getting is based on this FPL table. So again, if it's from 100 to 150%, they can lower their exposure up to 94% of the actuarial value of a silver plan. And if they fall all the way to 200%, it will go down to 87%. And then if they go all the way to 250% of FPL, then the reduction will be up to 73%. So almost 3 out of every $4 that they have to spend if they're at this level will be paid or recognized by the federal government, and they don't have to pay for it. Now, if the level of income is above 250% of FPL, but below 400% of FPL, then they will not get any type of help with cost sharing reductions, but they will get help with the monthly premium. So if the monthly premium was $800, they might end up getting a subsidy for $200 or $300. So now instead of paying $800, they're going to pay $600 or $500. So they will get help with the monthly premium if they fall here at from 300 to 400% of FPL, and they will get premium plus cost sharing reductions if they fall anywhere within the green colors that we have in the table. So again, that is the explanation of the table. This is something that you can put in a wall, and talk about it. Use it as a tablecloth and talk about it when people come to talk to you. You can have brochures and include a table like this and give them the brochure with your business card and tell them to that you can explain that to them, and if, they can give it to their friends or to their relatives so that they call you and you can explain to all of them how this table works and how you can maximize the level of help that you can provide them, the amount of subsidy that they might be receiving based on how to manage this table. Now, we have, I mentioned before the fact that if they are below 100% of FPL or above 400% of FPL, they don't get any type of subsidy from the Affordable Care Act. Now, there is a situation that you need to know about, and it's the fact that we have this Medicaid gap. And it's basically something that it's a flaw that started with the creation of the law and is still in place today. And it's the fact that Medicaid covers or helps people with their healthcare expenses starting at 0% of FPL and goes to around 40 to 50% of FPL. When they created the Affordable Care Act, when they created the law, the intention was that Medicaid would expand and will go all the way to 100% of FPL, because this is where the marketplace was going to pick up and start helping people starting at 100%. So the intention was that this no coverage area here would be picked up by Medicaid, and in this case, by the state. In the case of Texas, by the state of Texas. In the case of Florida, by the state of Florida, okay? But what ended up happening was that Medicaid did not expand in many places. So you have this no coverage gap, this Medicaid gap that really creates some really crazy situations. So let me tell you what I mean by that. For example, if somebody comes to your office and he wants help, and it's a household of two, let's say, and their total income is $18,000 or $19,000. Okay, so a family of two, total income let's say $19,000. So they fall around here. They will get a lot of subsidy for the monthly premium and for the cost sharing. So they end up paying very little, or in many instances, zero for the monthly premium, and then very little for any type of cost sharing that they might incur. Well, if that same couple shows up and they make $16,000 a year, so they fall to the left of this line here, they don't get any type of subsidy. So they have to pay for the totality of the product. And that is crazy. How come somebody that makes a couple that makes 16,000 doesn't get any type of help, and a couple that makes 18 or 19,000 gets all the help in this world? Well, that is because of this Medicaid gap, and there is no solution to that. It's just the way it is. It has been a political discussion that has been going on, but the end result is the fact that this is not working. Okay, and that's the way it is now. Additionally, in many instances, you have a situation where you are running a case, and you start getting all the information from all the family, and it's a family of four. They have, it's a husband and wife, and they have two young kids. One is 5 and the other one is 8. And you enter all the information for all the income from the family and all that. And then when you go to the results, it tells you that the kids need to go to CHIP, okay? They need to go to the Children Health Plan. So they will not get any type of subsidy from the marketplace. They cannot enroll in any type of product through the marketplace, and that they need to go to the state health plan. And this is the table that determines that. So and we have when we were showing you the resources at the Prinsuco website, we have a link to the CHIP, Texas CHIP website, where you get all this information. But I just wanted to show you, this is the table, okay? And basically, again, it also has to do with the family members, adults plus children, so everybody in the family. And then based on this family monthly income, and this is on a monthly basis, and this is on a yearly basis, then this table is the one that determines if the kids will get coverage through CHIP or if they will get coverage through the marketplace. Now, in many instances, when the marketplace rejects the kids and sends them to CHIP, then the family needs to go to CHIP and needs to go and process that application with CHIP. And if they are negated over there, then they can come back to the marketplace and enroll in a regular marketplace plan. So again, this is very important because you need to know as soon as you are getting the information from the individuals, if you are aware of these numbers here, you will immediately know what's going to happen with the kids. Okay, so you're going to tell them upfront, hey, based on the level of income that you are presenting and the age of the kids, what I think is going to happen is those kids are going to be sent to CHIP. They're not going to be approved, and we're going to have to go through an extra process in order to try to get them into any one of the plans that we represent. Now, on the other side, remember what I told you. If somebody is not asking for help and somebody wants to pay for the kids, and then what you do is when you are starting the enrollment, you just say, hey, we don't want any help. We don't want any help from anybody to pay for our health insurance. Everything that we have spoken about here does not apply. An individual can buy the insurance and pay for it. Again, all of these elements that we have been discussing here have to do with the fact that people are entitled to certain benefits, to certain subsidies offered by the federal government by law, and they can try to go for that. Okay, but it's not an obligation. They're not obligated to do so. They might say, no, I don't want it. And we're going to see a couple of situations where that would be convenient here. So again, this is the table for Texas, and the table for each state is a little bit different. They're not exactly the same. In fact, the plans don't have the same name in the different states, but the program is everywhere, and the spirit of the program is the same, to help those kids with health insurance for the families of people with lower income. So that's part of what we have there. Okay. Now, as you all know, we have this conflict that was presented as of day one in terms of the mandate. We have the employee mandate, which is the one that we deal with, and we have the employer mandate. The employer mandate, which is the set of rules and regulations that affect large employers. Okay, so you have certain rules and certain guidelines that apply to employers, and then you have a set of rules and a set of guidelines that apply to individuals, okay, and to employees. But there is this area of conflict where there is an overlap between those two worlds, and that created a lot of confusion, and it created a lot of problems. For example, if somebody works in a company where they offer health insurance, and the individual, by the fact that he or she works at that company, is offered health insurance, that individual could not go to the marketplace as an individual and try to buy a product and get a subsidy. They are not entitled to a subsidy through the marketplace if they are offered health insurance through their employer. Now, there are certain rules, and there are many rules, but I'm not going to cover all those rules. But there is one thing that we need to know, because we're going to follow up on that with the next couple of slides, and it's the concept of affordability. Affordability, okay, and that's what basically the fact that a policy or a subsidy or the help that is being provided by the employer, if it is affordable or not. And there is a set of definitions of what is affordable and what is not affordable. And basically, there is a number which is let's say the offer by the employer, if deemed affordable, if the employee share of the lowest cost of self-only coverage does not exceed, for this year, is 9.83% of the household income. So the point is this: if what you have to pay for a very specific product, maybe not the product that you have, but a very very specific guideline that the government defined. If you have to pay X amount of money, what you have to pay for that has to be less than 9.83% of your total household income. Now, this coverage is for the individual by himself. So it's the policy for him alone. If what he has to pay for that policy for him alone is over 9.83% of the total household income, then that is not affordable, and then the employer will get in trouble. But again, I'm not here to talk about the employer mandate because that's not the point. What I want to make sure is that you understand that there is this area of conflict, and this area of conflict in terms of who has the right to get all these subsidies and who loses that right has to do with the fact that whatever is being offered is affordable or not affordable. And that principle we're going to use a lot starting next year because we have a whole new window that is opening starting in 2021. Okay, now, when we started talking about the employee mandate and the employer mandate, basically for every one individual that goes to the marketplace, you have 10 individuals covered by an employer plan. So the proportion of people enrolling to one type of market versus the other type of market is 10 to 1. So for every individual in the marketplace, you have 10 people that are covered by some type of employer plan. So that market is 10 times bigger than the individual, the healthcare.gov or the marketplace market. So it's a huge market. Now, starting this year, we have a new concept, and the new concept is the health reimbursement arrangements, the HRAs, a health reimbursement arrangement, okay? And basically what HRAs are is a type of account-based health plan, okay? It's some type of account that an employer can use to reimburse employees for the medical care expenses. So basically, the employer creates this HRA account, okay? And it gives money to each employee. Okay, give money to the employees, and the employees can take that money to take care of some medical care expenses. That's an HRA. Now, there are a lot of rules associated with how this is applied, and it's very important that you understand them because with these HRAs, what you are doing before, if you wanted to get into the employer business, line of business, you know, when you wanted to do small and medium-sized groups, okay, you would go through a completely different avenue, and you would have to, you know, do group health plans and the whole thing with the large quotes and all that. Well, with HRAs, you can help individuals because if, depending on certain elements that we're going to see here now, you can end up enrolling all those individuals into a marketplace account, into a marketplace product, one of the products that you sell through the marketplace. But there are rules, and that's what we're going to be covering today, okay? So let's get started by saying that there are three types of HRAs, three types of HRAs. The individual coverage HRA, which is known as the ICHRA, individual coverage HRA, and we're going to get into some specifics of that. And then we have the accepted benefit HRA, the accepted benefit HRA. And then we have the qualified small employer HRA, also known as the QSE HRA, qualified small employer HRA. Okay, the two most common ones are the ICHRA, the individual coverage HRA, and the QSE HRA. These are the two most common plans. So let me emphasize that again. Let me put it like this. The two most common ones are the ICHRA and the QSE HRA, qualified small employer HRA, individual coverage HRA. So I'm going to be talking about ICHRA and QSE HRA, and these are different types of HRAs. Again, there is a whole training on this. for those of you, and I know many of you have gone through the training that we have for the Affordable Care Act, but we just added a couple of weeks ago 3 additional modules to that training on HRAs. There are 3 videos, some of them are longer than others, but it's going to give you a good insight into the whole concept of HRAs and how to use them and how to apply the calculators. I'm not going to cover some of that here today, but again, there is a lot of stuff on HRAs that you need to learn because this is huge. This is something where you can end up enrolling 100, 200. If you get a small employer, okay, and they implement an HRA type of arrangement, then you can enroll 100, 200, 300, 400 people into some type of individual marketplace plan, okay? So let's continue with HRAs. Again, employers can provide money on a pre-tax basis. So the money is on a pre-tax basis. So it's not income for the employee, very important. Okay, so this is basically a gift that the employee is receiving. It's not additional income. They don't have to pay taxes on that money that they're receiving from their employer. And they can use this money to apply to a qualified, to any type of qualified medical care expense. Okay, now, in order for the employee to be able to use this money, he needs to enroll into a marketplace plan through the marketplace with like the ones that we sell all the time, or into a Medicare plan. So the point is that this money that they're going to be receiving from their employer on a pre-tax basis is not just for them to go on vacation. It's money that they need to use for health care expenses. And that is very important. Now, there is no limit on how much money an employer can contribute. Okay, so an employer can give an employee all the money that he or she wants, okay, or the company wants. They can give them $100 a month, $1,000 a month, $3,000 a month, whatever the company decides. There is no limit on how much they can contribute. And additionally, there is a lot of flexibility because an employer can say, okay, I presently have a group health plan for all my employees. But what I'm going to do is that anybody that comes from now on, any new employee, any new hire, we're not going to get them into the group health plan, but we're going to get them into an HRA arrangement. So you have flexibility in terms of how an employer can manage these different types of accounts. And this is allowing them to be more competitive, okay, and to be able to attract better employees by using this type of HRAs or arrangements, okay? Now, again, the concept of affordability is very important because if what the employer provides the employee, the amount of money, and we're going to see examples now. I know this is a little bit confusing, but we're going to see some examples now. But if what is offered is considered affordable, okay, so they give them enough money so that it surpasses the affordability, let's say, requirement, then that employee who is going to go to the marketplace and is going to buy an individual marketplace plan, they do not have the capacity to accept a subsidy. They should not accept a subsidy from the marketplace because they're getting money from the employer, okay? And this is going to create a lot of problems for those agents and individuals that do not understand this, okay? This is going to make a lot of people, a lot of individuals that are not explained this by their agent. They're going to go to the marketplace. They do have an HRA. They do receive some money. They go to the marketplace. Either they don't report it or they don't understand it. And they go to the marketplace and they get help from the marketplace. Well, guess what? There are going to be penalties associated with that. Okay, now, so remember, and I don't like going back that much, but remember when we were talking about the different worlds, and we talk about how you had situation where somebody who existed in the world of subsidies, okay, might not want a subsidy. Okay, so he qualifies for this, or he exists in terms of their income and everything here, and they could go to the marketplace and they could get a subsidy from the marketplace, so they could live here, but they're going to decide to go to this world, the world of no subsidy. So they will be on this side. They will get one of these products that is fully, with all the entitlements and all the things about these products that are on this side of the universe. Let's put it that way. But they will be here in this world of no subsidies. Why? Because they are getting money from their employer instead of a subsidy from the government. So instead of them being here and getting a subsidy from the federal government to pay for the health care plan, they move to this world of no subsidies here, and they supposedly have to pay for the totality of the plan, but they're getting money from their employer to pay for it. Okay, so again, now we see how this table about the world of subsidies and world of no subsidies, when I first talk about it, some people say, but why would somebody want to be here or there? Well, now you're starting to understand and see specific situations of why somebody that would qualify for something here will not do it because they're getting money somewhere else, okay? And then they would run into some type of penalty. So let me move forward again, and I'm sorry about this jump here. Okay, so very important to understand that the fact that if the offer that is presented to the employee is affordable, they should not get the subsidy. Now, this is not your traditional health coverage through a job. This is not the traditional health coverage that you get through your employer is a group plan. Okay, so basically in a group plan, there is this company, Blue Cross Blue Shield or National General, whoever, the employer signs a contract with them, and they have all these options, and the family, the individual or the family select one of the options within the group plan. This is not that, okay? In this case, an employer just gives some money into an HRA, so there is a given amount of money, $100 a month, $200 a month, $1,000 a month, whatever, okay, that is deposited into this HRA account, and the employer uses the money to pay for qualified medical expenses. And in some instances, they can even pay for the monthly premium of their individual plan. So they can use the money that they get from their employer to pay for the monthly premium. Okay, they could use it again in certain, and that's why they say for some types of HRAs, and again, there is a lot of legislation and a lot of regulation around this. So that's why that you will see a lot of, for some types, and they're going to be very specific about certain things, because there are always exceptions and situations where it doesn't apply. So that's why they always give this heads up of, hey, make sure you know what you're doing, because there might be a situation where this is not valid and you need to know about it, okay? Now, what is clear is that the employee must have health coverage. They need to have health coverage in order to use the resources available from the HRA. It's not for you to go on vacation. It's not for you to go and buy more food. It's specifically for health coverage, okay? Now, it's very important that the employees understand their options before they make a decision. So it is the employee's responsibility to understand what's going on. Because if they do not understand what's going on and they make an error, they're going to be penalized with a lot of money. And we have seen a lot of penalties for a lot of money. We have seen situations where individuals that don't make any money at all get penalties of $8,000, $10,000, $12,000 because they didn't know what they were doing, and they didn't have the privilege of running into a decent insurance agent that knew what he or she was doing and got them into the right plan. Okay, and these HRA arrangements are an additional complexity level that we are introducing to all of these healthcare market, but it's also at the same time generating huge new opportunities. So there are situations like, for example, employees could pay more for coverage. They might end up paying more for the coverage that they are getting because of not knowing what they're doing. Or they might end up using more tax credits than they qualify for. Remember, they go to the marketplace says, yeah, you can get $800 a month. But based on the combination of the arrangements, they were only entitled to $400. So they're getting $400 a month more than what they're entitled to. Well, guess what? They're going to be held responsible for that money sometime in the future. And they can face tax penalties unless they understand that option. So it's serious, okay? And this is a new set of regulations with HRAs. They're gonna start becoming more and more popular, because now small employers are going to start saying, you know something, instead of me offering you a group health plan, I'm gonna just give an HRA to everybody, and it's gonna be X amount of money per month or per year, and they make sure that it's affordable. Okay, or it's partially affordable. That's another thing. It could be partially affordable, so that makes individuals partially entitled to some type of level of subsidy. Okay, and you need to understand that. Okay. The required contribution percentage is 9.78%. So let's talk a little bit about this. Okay, this is we're going to be talking about the affordability of an HRA. Now, very specific. Self-only lowest cost silver plan monthly premium. Very specific. Self-only, that means for the individual only. He has a family of 5. Well, we're not going to use the cost for the whole family. We're going to use the cost of that plan for him or her individually in a silver plan. So you take that, and there are these tables in healthcare.gov, and we also have them in prinsuco.com. We have a link there to those tables where you can go and see the cost of these silver plans, because it might not be the one that they're getting. He might be getting a bronze plan or a gold plan. So it's not what he's paying for. It's the self-only lowest cost silver monthly plan in their area. So they need to know that. They need to find out that. Then you take that and you subtract from that the monthly individual coverage HRA amount. So whatever so let's say the plan costs $500 a month. The self-only lowest cost silver plan monthly premium is $500. And he's getting $200 from his monthly ICHRA amount. So now we're going to be talking about $300 here. If those $300 are less than or equal to the household income. Now, make sure that you understand this. This is not the individual. This is the household. Here it was the individual. Here is the household. You take the household income, you divide it by 12. And then you make this calculation. And I'm going to give you an example of this. And if that number comes under this percentage here, then there is a decision to be made, yes or no. So very important that you understand that the required contribution percentage is 9.78%, and you need to understand how to calculate that, okay? You need to understand how to calculate that. Remember that at the beginning, when a lot of people would go to the marketplace and they had an employer coverage and they would say no and nobody was paying attention, and a lot of people enrolling to plans and they were not entitled to all these benefits. Well, a lot of people got in trouble because of that. Agents that had to disappear because of the trouble that they created for the clients, and individuals that couldn't afford, to pay for the penalties that came upon them. Well, we're going to have something similar to that with this. I don't think it's going to be as extensive as that then, because a lot of those poorly trained agents have, thank God, disappeared, okay? And people are more aware of everything. And so I don't think it's going to be, again, as extensive, but we're going to have some problems with this. So let's see exactly how we need to calculate that. Okay. So you have a whole section under the healthcare.gov website, okay? And again, you have this in several languages, okay? And basically the website is a healthcare.gov/job-based help. And again, I'm gonna show you this again, and we do have a link in our Prinsuco website. So this is where you go, and this is to determine the HRA affordability. If the offer that they're getting, it's affordable or not. Okay, so what the first thing that they need to do, remember what we said before, they need to have clarity of what they have. And for that, every employer that offers any employee one of these arrangements, they give them a document. And the document has certain elements to it that they are obligated to say certain things. So the language and the verbiage is there in that document. So the individual needs to know about the existence of this document and needs to have it with them when they're going to be making this calculation. So you need to make sure that you ask them, where do you work? And if they are not independent, okay, and sometimes even with independent, because they think that they're independent and they end up not being independent, and then everybody's in trouble. But anyway, if somebody works anywhere, you need to say, hey, do you know if you have any type of subsidy or help with anything associated with healthcare there? Did you receive any type of document? Whatever you got, bring it to me. Show it to me. Let me see it. Go back, go and get it, and come back with the document in your hand. Very important that you say that, okay? So you come up with that, and then you enter the zip code. You go to the website, okay, to the tool, and you enter the zip code. In this case, I did an example here with some specific zip code, okay? And then again, in the notice, in the HRA notice, it will tell them what type of HRA arrangement they have. It will tell them that if it's an IC HRA or if it's a QSE HRA. So it will tell them that. So it's very important that they know that, because the tool moves in two different directions based on which one it is. So you need to know this before you make any type of calculation. Okay, so you click there. Let's say we have an individual coverage HRA, so you just select there and you move forward. So I did an example here now. They enter here, as we mentioned before, and this is very similar to the way you calculate that conflict between the employer and the employee. The dollar amount for the head of household alone, okay? So let's say that the employer says, yeah, we're gonna give you money for you and money for your spouse and some money for your kids. Well, for this calculation, you just use the amount that is offered to him or her individually. So that's the amount that you enter here in the calculator, okay? So let's say in this case, it's $100 a month or $1,200 on a yearly basis, okay? So you enter, in this case, I'm gonna do it with $1,200 a year, $1,200 a year, which is $100 a month. So that's the amount of help that this individual is getting from the company to pay for his or her healthcare management. So this is an example. Now it says, tell us about your household income. Again, in a similar fashion as we did with the employer mandate and all that, here is the household income, not the individuals, but the household income. Everybody in the house, how much money does everybody in the house makes? And in this example here, I'm going to say $30,000. So the house makes $30,000, and his HRA contribution from his employer to him individually is $200 a year or $100 a month, okay? And he asks for the age, and then you get a result. So let's look at this example here. The HRA contribution is $200 a year. The household income is $30,000 a year. So you divide the HRA contribution over the household income, and in this case, it's $200 over $30,000, which is 4%. 4%. Okay, 4%. Now you compare that to the required contribution percentage. So you compare that against the required contribution percentage here, okay? And once you make that comparison here, okay, I'm sorry, I move here. Okay, so 4% is less than 9.78%. So the HRA contribution is not affordable. Okay, they're not giving him enough money. It's not, and here it's this reverse engineering. It took me some time to get accustomed to think this way because it's a double negative. Okay, the HRA plan is not affordable. If the HRA is not affordable, then that individual might be eligible for an advanced premium tax credit in the marketplace because the offer that he's getting is not affordable. So therefore, he has not lost the right to get a subsidy in the marketplace. Therefore, this individual should decline the HRA offering. He or she should say, no, I do not want the HRA offering. It is more convenient for him to decline it and go to the marketplace and get his APTC than to receive the $100 a month from the company. So what he needs to do is he needs to apply for a plan in the marketplace with you, the agent, and they need to enroll in the plan. Very important that you do this, okay? That's why he says what to do next. You need to apply in the marketplace to any one of the plans you want with all the subsidies and everything. And then once everything is in order and you already have the plan, then you go to your employer and you decline the HRA offering. That's how it works, okay? That is the order of things in terms of that. Now, let's look at a different scenario. In this case, we have an HRA contribution of $3,000 a year. Okay, so basically this individual is getting $250 a month, $250 a month. And the household income is the same, $30,000. So you take the HRA contribution divided by the household income, 3,000 over 30,000. So that would be 10%. So the HRA contribution is 10% of the household income. Okay, 10% is greater than 9.78%. So this contribution, this HRA plan is affordable. It's good. It's giving him or her a lot of money. If the plan is good, if the plan is affordable, then that individual cannot get an advanced premium tax credit in the marketplace because he's getting an affordable contribution from his employer. So he needs to accept the HRA offering. He needs to accept the HRA offering, okay? And then what he needs to do is he needs to apply, he needs to enroll in a marketplace plans with you, okay? And then he needs to accept the HRA offering. So he has to go to his employer and say, yeah, give me the $250 a month. I'm going to accept them. In this case, he should tell the marketplace, do not give me any premium tax credit because I'm not entitled to it. I do not want any subsidy from you guys because I am getting a really good package from my employer. So I'm going to buy insurance from you, but I'm going to pay for the totality of it because I'm getting money from somebody else to help me pay for it. Okay, so that would be the accept HRA scenario. Now, we have a couple of minutes, but I want to get into help on demand. We're not going to cover everything on help on demand, but I want you all to get started because it is a little bit more cumbersome than it used to be. But help on demand is something that is very important, and I need to make sure that you all get started with this. Help on demand is basically a scenario where a consumer requests help to the marketplace, and then that individual is matched against a broker like you. Then you as a broker accepts or rejects the offer, and then you connect with the consumer and sell them a plan. So this is a lead program designed by the federal government for those individuals that call the marketplace for help. Okay, so it's a consumer assistance referral system that connects consumers seeking assistance with marketplace registered state licensed agents and brokers in their area. Okay. Now, there are two situations here. Number one, if you are new to this, you need to get registered and go through the process, and I'm going to show you something about that. But if you were already with Help on Demand in the past, you need to update your Help on Demand profile. And I recommend you, and that's why I decided to show you this today, to do it right now, because it's going to take a couple of days. It took me a couple of days. I'm in the middle of the process. Okay, so this update to your Help on Demand profile might take a couple of days. And if you need to go through the whole process, it's also going to take a couple of days. So that's why I wanted to introduce this topic here today, because we need to make sure that you get started with Help on Demand. So let me get you started with that. The first thing you're going to do is you're going to go to your CMS portal, where you do all your certifications and everything. Okay, and under training options, and again, you can look at this again in the presentation. You can look at the recording. Under the training options, you're gonna click on what it says training options, and it's gonna show you the Help on Demand curriculum for 2021, fiscal year 2021 Help on Demand curriculum. This is the one that you need to do. It's not mandatory, but if you want it, you need to activate this course here. Okay, that's why it says that it's a recommendation. It's not mandatory, it's a recommendation. Okay, so you're going to click on actions, and what you're going to do is you're going to register for this training, for the Help on Demand fiscal year 2021 course. Now, once you do this, it's going to move into your current learning tab. So once you activate it, once you register, it's going to move into your current learning tab. And then once it's in your current learning tab, you're going to launch the course. So that's the process, okay? And again, it took me some time to look for it and find it and go through the process. But if you do it the way I'm showing you here, you should be able to do it. My recommendation is that you start this right away. Don't wait 1 minute. That's why I decided to present this to you. Now, there is a very specific process that you need to follow. Very specific, okay? You need to set your preferred contact method. You need to accept CMS's terms of use. You need to review your profile, because now you're going to say at what time, where. You're going to say a lot of things about yourself. Contact preferences. You're going to define what you want them to see about you. Then you're going to do your on-demand availability. You're going to say, no, I only work in the mornings, or I only work in the afternoons, or I only work Monday, Wednesday, and Friday. And you're going to set up your on-demand availability. You have to go through all that process and do that. And then you're going to start receive the referrals, okay? Now you're going to log on into marketplace.helpondemand.com. Once you get this referral, and I'm rushing through the process, this is for you to have this first exposure to the way it works. Once you get a referral, you need to update the referrals. You have to say if it's pending, if it's accepted, if it's rejected, if it was a good referral or not. And then you need to look at the metrics. Now, let me tell you the importance of that. This is how the process works. A consumer elects to use Help on Demand on healthcare.gov. So then the individual goes to health, and let me change this to something. The individual goes to healthcare.gov and he says, hey, yeah, I want somebody to help me. And they enter the contact information into healthcare.gov. Now, healthcare.gov, based on the individual's information and the information that you provided, okay, matches the consumer with an available agent or broker, somebody that is licensed, somebody that is available at that specific time, because remember you said at what time you wanted to work, and etc. And then once it matches the broker with the client, the Help on Demand alerts the agent that a referral has been received. Now, it can be done through an email, or it can be done through a text. Now, you have 15 minutes to accept or reject the referral. So you have 15 minutes. From the moment you get that email, you have 15 minutes to say yes or no. If you say no, then the referral is recycled and it starts looking for another agent. And if you say yes, then you contact that referral directly and you start the enrollment assistance process with that prospect. That's how the help on demand works. Now, it is a very rigid process, because if you start not paying attention to these referrals, if you let 50 minutes go by, if you don't, like he said here, if you don't update the referrals in terms of pending or accepted or rejected or delayed or not good, etc., if you are not diligent on using the platform, they're not going to penalize you in terms of a fine or anything like that, but they won't send you any more clients. So they're going to put you aside because you are not following the system. That's the importance of being very diligent about the whole process, okay? There are a lot of resources. Again, we have resources at the Prinsuco website, and there are also a lot of resources at healthcare.gov website and at the CMS website. A lot of resources, agent and broker resources, help on demand overview, tips for maximizing your participation in help on demand, manage help on demand referrals, help on demand how to update your profile, help on demand training and registration guide. There is a lot of information on this, and these are the links and all that. So I strongly recommend you that you get into this right away, because this is a free source of leads. Now, they will only refer to you people close to the address that you have registered with the marketplace. So they're going to be sending you people around where you live. Now, you're going to see certain instances, and when you go through the training, you're going to see this, where you might get somebody that is from far away, and there are certain situations, there are these special situations where the rules change a little bit based on certain overflows that they have, and that will not count against you if something happens, okay? But in general, in principle, you're going to get referrals of people that are close by to your place of business or your residence. That's how they have it set it up. And you will understand better about that on the training. The training takes like 1 hour, but then you have to wait 2 or 3 days for you to complete the whole process. So, okay, so I'm going to finish there. We went past 11:30, but I really wanted to make sure that you got exposed to help on demand. This is something that I want you to get started right away, because it's going to take you a couple of days to complete that. I want to make sure that you get started with that right away. Okay. So I don't want to go past this. We're going to be talking about enrollments and other things next week. Remember, next week, 10:30 to 11:30. Make sure you complete the training in the Amidin platform. We added 3 modules on HRAs. Make sure you watch those videos. Make sure you go through the whole training there. More important than anything else, make sure that you become acquainted with all the tools that we have at your disposition to make sure that you make money during this annual enrollment period. You know, when I see some agents making $15,000, $20,000, $25,000 a month, and I see other agents making $400 a month, I say, wow, what a difference. What a difference. And when I analyze those individuals that are making a lot of money, those individuals are doing all the training. Those individuals are learning how to do it. Those individuals are doing a lot of things to make a lot of money. And what I want to do is I want to elevate everybody's income for this coming year. This is going to be a very important annual enrollment period, and I want to make sure that it's successful for all of us. So again, everybody, my name is Al Castellanos. Thank you very much for your participation in this training, and I look forward to seeing you next week for our following training. And also make sure that you participate in our digital marketing training on Wednesdays to help you to use digital marketing to market for the Affordable Care Act and multiple other lines of business. Thank you, everybody.